for consumer reports. Thank you.
Thank you so much. So I've worked for many years at Consumer Reports on healthcare issues, including surprise billing. And last couple of years, we've been working to try to reduce surprise billing from ground ambulances, which was not covered by the No Surprises Act. It's very common for people to get a bill of $1,000 or more. So we think if you protect against the surprise bill you get in the hospital, why not protect people on the way to the hospital and ban that as well? So a few states 14 states have taken action, and it goes to the point that while this is a pervasive national problem, 100 million Americans have medical debt. 1 out of every 3 adults, 41% of U.S. adults, more than 1 out of 3. We can take action to solve it, and a lot of the good organic action is bubbling up from the state level. We can solve this problem in a democracy, and I think it's really important to ask the question: how do we get to the point where there is no more medical debt? That right now is about $195 billion in medical debt for the country as a whole. And it's a problem where many people are suffering in silence. They have debt on their credit cards. They have debt that may have been sold to debt collectors that have gone into collections. From there, it can go to severely damage your credit standing, often results in lawsuits against the patients and then court judgments where they can garnish your wages, sometimes put a lien on your house, or clean up your bank account. So it has devastating financial consequences for people, and yet it's become so common. And to give some national perspective on why we have it, one of the reasons is insurance coverage not being adequate enough, not covering everything that the patient needs. So that's a long-term problem. Many of us have been working on to fix that. But many people who are insured are taking on medical debt because they have high deductibles and high co-payments. And yet many households don't have the $2,000 for an individual or $4,000 for a family account to come up with the co-payments that they might have to come up with during the course of the year. So that's really contributing to the problem. But the second thing is the medical billing system itself is highly dysfunctional, and it takes a very long time to adjudicate insurance bills. If anyone's ever had a hospital visit, you might get several bills from the visit, and they come at all different times, and sometimes they come 8, 9, 10, 12 months after the procedure. And a lot of times those bills are getting paid off by the insurance company, but the hospital or the provider can't wait, and they've sent it to the collection bureau. And then from there, we are working in other states to protect consumers against the damage to their credit standing, because one of the most common types of debt, was the most common type of debt until recently. Over half of all credit reports have medical debt on them. Even people who have no other type of debt would often find they have medical debt. Oftentimes too, about 10% of people would see for the first time they got a medical bill by looking at their credit report. It's never sent to them, it was sent right to a collection agency. So now 2 states, New York and Colorado, have banned the reporting of medical debt to credit bureaus, and the CFPB, the Consumer Financial Protection Bureau, is going to do a national rulemaking to ban it in all 50 states. It might take several years, so we would encourage Maine to look at this issue and ban it here as well. But CFPB believes that medical debt is not predictive of your financial repayment risk to pay off your car loan or your credit card. There's just so much noise in the system. There's lots of inaccurate data reported to credit bureaus that really doesn't belong there. So they also agree, and they're working to take it out of the federal loan programs like the SBA and the VA. And this is a big national policy shift that's starting to happen. But why do we allow the medical debt to be reported to credit bureaus? It's because the debt collectors like to use that as a tool to threaten people to pay up. And what we are concerned about is that this really damages the financial standing and economic standing of families who have other things they need to do. They need to get a car loan at an affordable rate so they can go to work and earn the money to pay off the medical debt. So if you make their interest rate higher for the car loan or for their credit card, you are destabilizing that family's finances. And all the survey data we have that we'll be talking about more today is it shows that medical debt is really a threat to household financial stability. You have about 42% of people here in Maine that live literally paycheck to paycheck with no substantial savings. And about half of Americans, if they get an unexpected medical bill of $500 or more, they can't pay that bill without selling some things that they own or borrowing money from relatives. So people don't have a lot of extra cash lying around to solve these problems. So the other way that the states can put more guardrails around these policies would be to try to make sure that medical providers give consumers a fair chance to pay the bill at an affordable rate. Many dental providers, many hospitals, they do have programs to allow the consumer to make monthly payments at a low interest rate, but some of these have been going away, and you have some providers are switching now to commercial products like credit cards. And credit cards, as was mentioned, they're highly, highly risky because the interest rate on the typical medical credit card is 29–30%. And they will often give you a grace period of several months at 0%, but if you don't pay by the deadline, all the interest is retroactive, and you're stuck with, your healthcare is now going to be a third more, or at least a third more and more expensive. So with all the debt we have in the system now, I don't know why we would want to erect storefronts around the healthcare system and have even higher cost credit coming into it. So we think that that would be a very important protection. And also encouraging more hospitals to offer generous financial assistance at higher income levels. I think in Maine you can get assistance up to 150% of the federal poverty level, which is a pretty low salary. And yet there are many working class people who are getting hit by this problem, even people who have insurance who also need assistance. So I think looking at raising those limits, but also promoting the availability of assistance to the patient when they're in the hospital. When we're in the hospital, we're there to get treatment and get well and go home. We're not thinking about filling out a lot of papers to apply for financial assistance, and yet there needs to be a way to connect consumers with that type of a tool and give them a chance to pay their bill without aggressively sending it to debt collection where it's going to ruin someone's financial standing. And then the last thing to do is just let's make the culture, there's a punishing culture of debt collection. We need to make it less harsh by not allowing people to file lawsuits against patients, take their wages, put a lien on their house, clean out their bank account. People are often left with hardly any money whatsoever if they're the target of a medical debt lawsuit. So we can do better as a country. We can bring down the amount of medical debt that's out there. But first of all, we have to recognize we have a severe systemic problem, and so I want to thank the legislature here in Maine. Thank you for stepping up to this problem and proposing leadership bills that will help to reduce the scope and severity of it for people who live here in Maine. And thank you so much for inviting me here.
Thank you, Sean.